Hello students, we will discuss a condition which is again very commonly seen, a swelling and very important clinically and managing patient and academically and MCQI theoretically also. What this condition is, just look at this here, multiple nodules are there all over, from the skin, all over body it is there carefully if you see, and one is very big. And if you carefully watch, there is a incision, sutured wound is there here, sutured wound is there, so multiple are there. So what is this? Imagine what is this condition. If you carefully see, there are still multiple are there, small pigmented patches are there in the body. So what is this condition is? So this is von Recklinghausen disease of neurofibromatosis. It is generalized, multiple neurofibromatosis. So it is a familial condition. Of course, here one of this neurofibroma has turned into sarcoma, neurofibrosarcoma. So it's very big. So attained a very large size, around 20 centimeter size. So somebody has done the incision biopsy to have, because for sarcoma, either true cut biopsy or incision biopsy is ideal investigation to get histological evidence, not FNAC. Never do FNAC. FNAC is not ideal. So true cut or ideally incision biopsy. That's what we did. So true cut biopsy, incision biopsy were done for the confirmation of the diagnosis. So this is von Recklinghausen disease with the sarcomatous changes. And so what are the features? It is autosomal inherited, chromosomal 17, it is type 1, familial with the neurofibromin protein. This is an MCQ question. For type 1, chromosome 17, and it is autosomally inherited one, and neurofibromin protein. And kephioelate spot is very important, it's very typical, kephioelate spot. More than 5, more than 2 centimeters, like that in the body, pigmented, coffee-like pigmented spots all over the body will be there if you carefully watch. It's very significant of von Recklinghausen disease of neurofibromatosis. Axillary freckles will be there in the axilla. Lischy nodules, small hard nodules. They are called Lischy nodules, multiple cutaneous nodules. Degeneration, erosion, because this may erode into the deeper plane, bone, vessels, nerves, neurovascular bundle, then pain. In such a situation, surgery is required even though it is benign. And sarcomatous change is the most dangerous thing because it may spread to the lung, to the blood, into the lung or other systemic areas and may cause metastatic disease. So that is the most dreaded complication, sarcomatous change. And next is compression features or the complications. Now type 2 is acoustic neurofibromatosis here. Chromosome 21 is a MCQ question. Merlin protein is a protein involved in the type 2 neurofibromatosis is the Merlin protein. Type 1 is chromosome 17 and neurofibromin protein. Neurofibromin protein, that point you have to remember. Chromosome number you have to remember. Type 1 and type 2. This is the point you have to remember. So that is about von Recklinghausen disease of neurofibromatosis. First thing which may turn into sarcoma. That's the point you have to always remember. Incision or true cut biopsy is ideal investigation to confirm that. So you can, how to examine neurofibroma, you can go through my clinical methods in surgery with the video, and you can read in detail whatever the test aspect, theoretical aspect for MCQs and exam, for writing question paper answers. You can you can go through my SRB manual of surgery, of course operative surgery, how to excise these things, how to reconstruction, and detail any operative procedures in detail given in operative test with the 2-volume operative book and atlas of tissue approximation for suturing technique. My DigiNow lectures are good for every student, UG and early PGs. In detail, everything is covered, including specialties briefly with the X-ray instruments, specimens, and X-rays and operative procedures briefly. So students, you can always subscribe my DigiNow for 1 year, so I have a detailed idea to face the exam. So I hope you understood about neurofibromatosis very well. Thank you very much.